We're back at CBS Radio. Dr. Jay Berenter still in our studio. Let's talk specifically about heel pain.
Heel pain's probably one of the most common things that I see in my office, particularly these days with the running craze and people trying to stay in a little better shape. Typically, most heel pain is related to plantar fasciitis, and the plantar fascia is actually a tight ligamentous band that goes from your heel all the way out to your toes. The problem becomes over time, as we all go along in life, that the arch starts to flatten a little bit, and as the arch flattens, it elongates, and this causes tension along the plantar fascial band. Much like if you have a rubber band and you really pull and stretch it, the rubber band frays, and this is what happens to the fascial band as you put it under tension when you're walking or running over time. It typically presents as pain in the morning with the first few steps. The first 5 or 10 minutes are particularly painful, and then through the day, if you're on your foot or you do any kind of significant exercising, you'll get some pain directly on the bottom of the heel. Unfortunately, plantar fasciitis, although it's very common, is mistreated very frequently. And what happens is that people direct their treatment at symptoms and not treating the root cause of the problem, which is the overpronation or the arch flattening a little more than what it used to. So on the internet, or if you go research it, you'll see stretching exercises or different kinds of shoes or rolling it across a golf ball, and none of these things really address the root cause of the problem, and that's where you hear about plantar fasciitis taking so long to get over. It's not that hard. What we do in the office is, first of all, you got to get an x-ray to make sure you don't have one of the other things that can mimic plantar fasciitis. So we'll get an x-ray just to eliminate stress fractures or bone cysts, and certain kinds of arthritides actually mimic plantar fascial pain. Once we establish that it's plantar fasciitis, we direct our treatment at the root cause, which is the arch flattening. So we use some kind of insert, typically a custom foot orthotic that we do. Now, we utilize an optical scanning device that we use for our Olympic athletes because we take care of the Olympic Training Center. So we use the same device on our everyday weekend warriors too, and they get a custom insert. Once we start the custom insert, we eliminate the cause of the pain. The plantar fascia doesn't get stretched, does not become irritated, and it's a simple problem, and usually within a few weeks the pain goes away. In addition, we utilize night splints to wear at night, and vigorous icing program. Once in a while we use physical therapy. And in addition, in our office we have a special machine, an extracorporeal shockwave machine that we can do in the office that mimics what cortisone does but with no side effects if you were to get a cortisone shot.
Okay, now you mentioned in a few weeks that pain goes away. What does that patient have to do on a maintenance schedule to make sure it doesn't come back?
Good question. Typically we just have them wear their inserts, the new custom orthotic, and in the beginning you have to wear them all the time to get the acute pain to go away. Mm-hmm. But then it becomes just an issue of wearing them when you're working out, typically maintaining some good arch support in the shoe, and usually the pain stays away.
Wow, so somebody who has been dealing with this and the pain and all the frustration with it, let's say over the last couple of years, in effect, if they were seeing you and going through this procedure, that could go away within, 6 to 8 weeks? They could start to see some remedies?
Usually 6 to 8 weeks is a typical period, even if they've been dealing with it for a year or two, which is not uncommon. We see patients that have been, again, doing all these other treatments that are just directed at symptoms. And once we get them into the proper orthotic, it usually goes away pretty quickly.
Where can people find out more information about this?
On our website at drberenter.com, we have a section on plantar fasciitis, and I'd encourage you to go there. A lot of the, unfortunately, online websites have some information that I just don't necessarily agree with and is a little bit outdated.
People can call for a consultation if they'd like to come in for an initial visit?
Correct. You can call my office anytime. The phone number's up on the website. Be happy to see you.
Dr. Jay Berenter, podiatrist. Thanks for coming into CBS Radio.
Thank you.